Mrs. Perron, I have your medication, okay?
This is Geneviève Perron's twice-daily ritual. She has 12 pills to take. However, that's a slight improvement. The 82-year-old used to be on more meds.
One was pretty big, and I was very glad to get rid of that one.
Doing this used to be a challenge. Geneviève couldn't walk a straight line until recently. She thinks the number of meds and their dosage were the culprit.
I'd go from this side of the sidewalk to the other side of the sidewalk. I couldn't stay straight on the sidewalk. Couldn't walk a straight line.
They just thought you were friendly.
Yes, I tried to smile.
Geneviève was referred to the Briere Day Hospital, where a pharmacist did some investigating.
I feel like a private investigator sometimes.
Dr. Barbara Farrell sees patients and confers with their caregivers.
Today I thought we could just review some of the changes that we've made with your wife's medications while she's been here.
She often eliminates a number of drugs being taken over a couple of months.
Some of the patients might have been on a medication for 45 or 50 years. The original prescriber has died. They've had 2 different family doctors since then. They've seen multiple specialists. So sometimes by the time they get here, they don't know why they're on the medication, but their doctor also might not know.
Taking too many meds can increase your risk of side effects. It can lead to confusion and falling. Often only a few medications need to be eliminated. Sometimes, though, it's more drastic. Farrell's worst case?
When she started here, she was taking 29 medications. She was confined to a wheelchair because as soon as she got up, she would get dizzy and she would fall. She was sleeping something like 22 or 23 hours a day, had to be woken up to give food and to give medications to. And over the course of 10 weeks, we stopped 13 of her medications. By the end, she was walking even without a cane. She was knitting again.
When a person has too many prescriptions, sometimes they just give up.
This is one that she was finished. So you can see she's only actually taken about half the medications in the blister pack.
Farrell says you need to know what your loved one is taking. Knowing can save time if your parent or spouse ever ends up in the emergency room. It's also recommended you buy a dosette.
It's a really easy way to check and see if medications have been taken correctly. And it's got the days of the week across the top from Sunday to a Saturday, and then there's a box for morning, noon, evening, and supper dispensing.
Geneviève is taking 2 less pills a day, and the dosage is down on many others. It means she's no longer walking like the self-described drunken sailor she once was. And that suits her just fine. Kate Eggins, CTV News.
Well, tomorrow Kate turns her attention to you, the caregivers.
Your stress, your worries, and the healthcare workers who can help.
Now, if you have a health question or story idea, contact us at ctvhealth@ctv.ca.
And Mr. Clark is out at